a large portion of the experiments on the International Space Station are designed to find out how that alien environment impacts the human beings we send there. Commander Steve Swanson and Flight Engineer Reed Wiseman are scheduled to gather data for one of those experiments, known as CardioOx, and it's looking into whether or not elevated stress is related to an increased risk of atherosclerosis in astronauts during or after spaceflight. The principal investigator is Dr. Stephen Platts of the Biomedical Research and Environmental Sciences Division here at NASA's Johnson Space Center. I spoke to him recently about this research into the cardiovascular health risk of long-duration spaceflight and asked if we know for a medical fact that spaceflight causes stress in astronauts.
We don't know for sure, and that's always something with science. It's hard to tell anything for sure, but there have been several experiments over the past few years that have shown an increase in the biomarkers that are shown with oxidative stress. And most recently at a meeting in Canada, several groups presented data showing that there were increases in oxidative stress and increases in the way that the blood vessels change during spaceflight. So we're seeing more changes than we had previously anticipated. So it fits very well with our experiment.
So we are collecting data that is helping us determine whether or not that is a cause at all. Mm-hmm. Now, can you tell me a little about the difference? What are the difference between oxidative versus the inflammatory stress?
Sure. So the oxidative stress is what's caused basically by everyday function. Every cell in your body, when it burns ATP, produces a free radical, that's what we used to call it, but a reactive oxygen species or a reactive nitrogen species. So these are the things that they're in your body naturally. It's part of the normal process. And then you also produce antioxidants, so things that clean these up. And you need them in your body. That's one of the primary ways that your white blood cells fight infection is with these compounds. So if you don't have them, it's bad. Mm-hmm. And you hear on TV all the time, well, you should eat blueberries and eat dark chocolate and drink red wine because they have antioxidants, right? Yeah, I know. I do too. But those are because they're antioxidants. So you want to be careful. You don't want to take antioxidants unless you need them. But recent research has shown that many disease processes involve oxidative stress, and that's what happens when that balance is skewed in your body. So either you're producing too many oxidants or you're not getting rid of them enough. So there's this equation of fine balance, and that's disrupted. So you're tilting towards a more oxidative environment, and that's when you can get damage to DNA or protein changes or changes in the vascular wall, which is what we're looking at, how those things occur. And those are precursors to inflammatory stresses. So it's oxidative stress occurs that creates an inflammatory environment, and then that inflammation really can damage the tissue and lead to a pathological state like atherosclerosis.
Okay, great. Thanks for that. Well, so I can only imagine, but can you tell me briefly what causes the stress for the astronauts?
There are quite a few things. So again, here on Earth, we're extrapolating a lot of this up into space, but we know that radiation causes oxidative stress. We know that certain types of diet can cause it. Physical activity, both too much and too little, can increase your oxidative stress. Even something like psychological stress, just the confinement of being up in space, increases the oxidative stress. And again, a recent study that was presented up in Canada showed that just confinement alone, the psychological stress that occurs with that, changes the vascular wall and how that blood vessel then functions.
Okay. Let's talk about this thing you brought here today. Can you tell me about how we are going about collecting the data?
There are two main ways we collect data. The first is the biomarkers. So we want to look at blood and urine and see which markers of oxidative stress or inflammation are elevated. But the primary way we collect physiological data is with the ultrasound machine here. And this is our portable ultrasound. It's exactly the same as the ultrasound that's on station. Up there it's called the Ultrasound 2. It's the second unit they've had up there. We have it configured exactly the same as they do on station, again, so that we can talk them through their data collections in the minimal amount of time possible. Here you see a carotid artery, and this is one of the primary arteries that we're looking at for this experiment. Over here is a black and white image, and if you blow up this area, you can see a larger view, and this is Doppler ultrasound. So this is much like a weather map where they're showing the rain moving, we're showing blood flowing. And so we will use these data to help us calculate what the blood flow is in that artery. We also use diameter measurements, and one of the most important things we do is measure the thickness of this wall. And for our study, the thickness of the wall is a critical component. That thickness has been shown to relate to a long-term risk of atherosclerosis. So that's one of our primary outcomes, is how thick does that wall get? And then does that relate or correlate to a change in the biomarkers that we're getting in the other part of the experiment?
And the astronaut is using, you have...
Yes, we have a ultrasound probe here. So when they're doing a collection like this, they will take the probe and hold it, and like the carotid artery would be right about here, and they would manipulate it, and from the ground would be telling them, okay, move it to the left, move it to the right, rotate it this way, and they can do these types of things. We also do some cardiac measurements, and you can do that like this. And then the brachial artery in the arm is what we're using as our control vessel. So that vessel is at the same level as the heart, shouldn't change much if you're looking at pressures, and we're using that to look at function as well as structure. So we can do other types of experiments where we see how that blood vessel functions. We can see it get bigger and get smaller when we do different perturbations to it.
And so I assume you take various data takes before, during,
yes,
after,
we do pre-flight, post-flight, and then in-flight.
Tell me what you hope to get from the results of this.
Sure. One of the things we don't know is if spaceflight increases the long-term risk of an astronaut having a cardiovascular issue in the future. We've done some work looking at what's happening in flight, but we don't know long-term. So this study will help us to figure out if we have a long-term risk. And a lot of that is we're recognizing that it's not a one-shot deal, right? You give a stress and you're not necessarily going to have a problem right then, but 10 years down the road, you may have increased their risk. And so this study is one of the few studies that has a surveillance part to it. So we're looking at these astronauts for 5 years after they return from space to see if there's any chronic changes or chronic inflammation that's going on. And that's very important for clinical medicine here on Earth. They look at these types of markers and look at the risks that people have over time. And there are some epidemiological studies that have been done, the most famous being the Framingham study, and they create a number to give you your overall risk for having heart disease in the future. But a lot of these models are now adding in the vascular age, and people have probably seen that on TV now, the vascular age. Oh, I'm a 90-year-old as far as my blood vessels are concerned, but it's a real number, and different people calculate it different ways. But what leads up to that is how are your blood vessels functioning? And we're hopefully going to be able to contribute to that, to say, okay, if you have this much change in your blood vessel function or this much change in the structure, how does that relate to your long-term risk of having cardiovascular disease?
Very, very interesting and important work that you're doing, you and your team. I appreciate you coming out. That's all the time we have, and showing us all the work that you are doing, and much continued success.
Great.
And hope we get more answers to keep us heart healthy.
All right, great. Thank you.
Thank you so much.